Hello, my name is Liam Goodale from Burlington, Massachusetts. I'm going to describe a public health organization in my community, simply the Burlington Board of Health. Whoops. Okay. The Burlington Board of Health is a small team that still has many functions in my community. To the right, you can see a screenshot from their website. Their website was pretty bare, to be honest, but I did my best to get what I could from it. You can see the 5 board members shown in that image and other members, staff members, listed below. Some of the services that they provide are hazardous waste collection. So this is everything from insulin needles, which pose a risk to municipal waste management. If a needle were to poke out of a bag, someone could become infected, at the very least injured. It also includes cell phones, the batteries, and maybe other components as well, pose an environmental risk when they're found in landfills, and perhaps a different interpretation of the term hazardous waste. They also collect expired medication. They partner with the local police department. It's seen in many communities, this one as well. They collect expired medication, so keeping it out of the hands of teens or other, perhaps even burglars, keeping expired, unneeded medication out of the hands of people who may abuse it. So a very important, excellent service that they offer. Another service is home radon testing. These fine ladies and gentlemen aren't going door to door to test your home for radon, but they're putting you in touch with those who can. In addition, they're asking residents who do receive home radon testing, and it is recommended you do it, to share their findings with them so they can put together a database, assess the problem, understand how great a risk radon is posing to my community in Burlington. And that's how the public health sphere is able to make informed decisions. It's very important. Disaster preparedness. So specifically, most recently, they had a seminar on what to do in event of a hurricane. Fittingly, we're all aware of the tragic news of Hurricane Dorian in Florida and Puerto Rico. They're preparing for what could happen if it were to strike New England. So this is important for several reasons. First, so city officials are aware what they need to do, what to do with the power grid, how to direct evacuation, and so on. And for non-city officials, residents, community members, how do they stay safe? How do they prepare ahead of time? Stockpiling food, water, generators, and so on. And also, should the need arise, how to safely evacuate. So we're not bumper to bumper and panicking. We're not making the problem worse than it needs to be, you know? Food safety. So this includes oversight of restaurants, school bake sales, and everything in between. Specifically, they mandate sanitation and transparency. So employees have to wear gloves, they have to wash their hands. The universal rule that we're aware of, employees must wash hands before returning to work. So this is one of those things. But then also, this also applies to school bake sales, you know? Food safety is important in all aspects, not just the private sector. And people have to be aware of what they're eating. So you have to share what ingredients are in your foods. People with allergies have to be safe, and in order to track an illness. So aside from allergies, for example, like with the salmonella outbreak with lettuce, that's not a Burlington, Massachusetts problem. That was more of a federal problem. But if you can recall how the FDA was able to track that it had occurred from a specific farm, a specific crop of iceberg lettuce, I believe, in California, for example. I don't remember exactly which one, but by knowing exactly what's in it and where it was, what was being served, and having preventative measures in place, you're able to A, prevent the spread of illness, and B, track it after the fact. So in my long-winded example, the public health on the federal level was able to determine quickly where this contaminated um, vegetation was coming from and quarantine it. So another service, anyway, that the Burlington Board of Health offers is the annual flu clinic. So this largely plays into herd immunity, very much a part of the public health mentality, offering free vaccination by volunteers to those who may be unable to normally receive vaccines for flu each season. So bringing it to them, making it easy, and those perhaps without insurance, so they do not have the flu vaccine covered to them, maybe they are unable to get it, can receive it and can lower the risk to others. So providing or contributing to herd immunity. Very important. They also have a community health fair. So they describe this as being for all ages. Some aspects of it, I would say, though, are more geared towards teens, and other aspects rather, more geared toward seniors. So an example of each, they had a booth most recently, 2018 in May, they had a community health fair. They had a booth for e-cigarettes, describing the risk of them to teens who may be misguided in the myth that e-cigarettes are harmless, that they're just water vapor. Because in reality, as we probably know, they are still a vector for nicotine addiction, and at the very least, in that respect, are dangerous and a public health risk. For seniors, the service that they offered at the community health fair was a demonstration of gentle, safe, simple home exercises. It's very important to keep active at all stages of life, but especially so perhaps in your old age. Lastly, another thing that they did at the community health fair, they partnered with the local Burlington Police Department and had self-defense training for school children. So as we know from the reading, public health services largely fall into one of three buckets: assessment, policy development, and assurance. This was described in the 1988 report, The Future of Public Health. To the right is a cover of this report by the U.S. Institute of Medicine. So I've reiterated the services by the Burlington Board of Health, and what I've done is I've drawn them into one of the three buckets that I described: assessment, policy development, or assurance. So to come to these conclusions, I've largely read into not just the three buckets themselves, but in the reading as they're described in the 10 essential public health services, which, as the reading described, was after the fact report that really fleshed out what these entail. And so with that higher level of detail, I assigned each of these services to one of the three buckets, as I called them before. So hazardous waste collection services, an example of policy development. So it is a policy to support community health efforts, in the words of the 10 essential public health services. Home radon education and data collection, this is assessment. So the data collection is, in the words of the 10 essential public health services, monitoring health status to identify community health problems. So that was a paraphrase of that. Disaster preparedness programs, such as the hurricane evacuation procedure that I described. Policy development. Food safety, guidelines for restaurants, bake sales, farmers markets. the annual flu clinic vaccination. That is assurance. So food safety specifically is an enforcement of policy. So a perfect example of assurance. The community health fair, again, policy development. So prevention. A lot of public health is preventing the illness, preventing the problem, preventing the public health risk. So I've described primary and secondary levels of prevention already without outright saying that they are. And tertiary, I've turned to another resource to describe that. So for primary, the booth at the Burlington Board of Health Community Health Fair about e-cigarettes, the risk of them, demonstrating that to teens, that was an example of primary prevention. We are ideally preventing teens from getting involved with their use, preventing the nicotine addiction, preventing the health risk, discouraging them from using e-cigarettes altogether, largely. So secondary, that's going to be the exercise for seniors. So we are introducing them to a healthy habit of exercise, easy exercise to do at home. So I want to distinguish this from primary, and in my mind, it distinguishes itself from primary prevention such that primary prevention of, for example, obesity would be an already in place routine exercise. So routine exercise, if they were already very fit, regularly exercising, they would be preventing lifestyle ailments such as obesity. But by introducing them to this just now, it's not a routine, it's not already in place, we're not already in perfect health. It is secondary. So we are stopping the continued, we're stopping the progression perhaps of obesity or another lifestyle related ailment. And we're introducing them to a new healthy habit. It is secondary prevention in my mind. So tertiary, I haven't yet described an example of tertiary prevention from the Burlington Board of Health. So I turn to a part of my larger community, the greater Boston area, the Boston Public Health Commission. So they offer Narcan training and offer services to get residents in touch with resources to request Narcan rescue kits. So Narcan is a new, in some people's words, miracle drug. It is able to rescue opioid abusers from overdose. It is able to save lives. Incredible. So Narcan administration is an example of tertiary prevention because the problem has already happened. They have already abused opioids, and they've already, in fact, overdosed. And this is the last resort measure. It is rescuing them from the brink of death, rescuing them from overdose. Tertiary prevention. So to the right, rather, I have a figure. It is from the Boston Public Health Commission, from the same webpage that I got this information from. It is a flyer that they have as a part of their Safer Bathroom initiative and discussing the problem of opioid overdose, specifically in public restrooms. So this is very much a public health risk, and I thought this was fitting and relevant. So they're turning to the community for help. They're offering services for the community to help address this problem, very much in line with the public health mission, the public health goals, and the outreach of the public health. So thank you very much. Here are my references in AMA style. Thank you.